Thank you so much, sir. I am really thankful to scientific committee of Vision 2020. They have selected me for this topic, but I am not sure whether I'll be able to justify it because I am not a clinician, never been OT, but still I would like to justify about the guidelines related to cataract surgery, NPCB guidelines. In fact, I would like to take you back in 1986-89 survey when we found that cataract is responsible for 80% of blindness. And at that time, it was mainly the outreach camp approach was promoted in country. But in 2001 survey, it was found that nearly 33% of patients who were operated in outreach camps, they were blind after cataract surgery. So at that time, Government of India, they had these guidelines called cataract reach-in approach, where screening camps can be conducted outside, but surgery has to be done in base hospital. Unfortunately, health is a state issue. Some of the states, I remember Jharkhand and Haryana, they're still promoting eye camps. And I have heard that in Tamil Nadu, some people are conducting outreach camps. So still it is in process. Currently, country is going towards cataract blindness backlog free initiatives. And under that, we have taken initiative of 2.7 crore surgeries in 3 years. That means we are thinking of high volume surgeries in country. And if we see, it is not only endophthalmitis. If you see visual outcome after cataract surgery, as per the recent survey, 10.9% of the country surgeries having poor visual outcome, that is less than 6 by 60. If we are performing nearly 70 lakh surgeries per year, then 7 lakh people they have poor visual outcome. And one of the important reason is operative complications, which is responsible for 31.2% of this. That means nearly 2-3 lakhs people they have visual outcome because of the cataract surgical complication related to operation theater. Whether NPCB guidelines are there for cataract surgery or not, in fact, a lot of people are not aware. Recently, there were some outbreaks, and at that time, even Dr. Namta Sharma, she asked me whether NPCB guidelines are there or not. But I'm happy to say that NPCB guidelines are there. They were formed in 2016, and Dr. Ravindran himself is part of that committee actually. And these guidelines are related to preoperative, operative, and postoperative precautions. As far as preoperative precautions are concerned, they are related to patient screening, the general examination. They said that should be conducted camps. Whenever screening is to be done, it has to be done one day before the scheduled date of surgery. And there should be thorough checkup of BP, blood sugar, and ECG for cardiac and hypertensive patients. And plus urine examination also. And we should look for systemic illness, and it has been suggested that all high risk patient, including patient with uncontrolled systemic illnesses, should not be enrolled for surgery if you are looking for high bulk, high volume surgeries. For related to ocular examination and in preoperative precautions, they said one-eyed people should be taken, a special precaution should be taken care of one-eyed people, and intraocular pressure along with other investigations to be done. They said for nasolacrimal duct and negative regurgitation tests should be conducted, and in case there is issues, then these patients should not be enrolled for cataract surgery. Syringes should not be done on day of surgery. In fact, all the investigation should be done one day prior to surgeries. And in case of adnexal infections, systemic antibiotics should be given. And if other diseases are there like entropion trichiasis, decrocystitis, they should be treated first. And it has been recommended that there should be gap of at least 3 weeks after these surgeries if somebody need to perform cataract surgeries. In fact, Dr. Harpreet has given very nicely, my session is easy. She has covered most of the things. As she has mentioned, there are four zones for operation theaters, and each level has to be taken care of. In fact, the level 3, the aseptic zone is the most important one. It should be totally sterile. It should be fumigated. UV light is suggested at night. Floor wall surfaces to be scrubbed and carbolized, and OT must be air conditioned. So these are specific for level 3 aseptic zones. And the second component is the precautions in operation theater. They are mainly related to sterilization of OT instruments and consumables, sterilization of instruments in between the surgeries, documentation process for sterilization, And for surgical supplies like irrigating solutions, ocular, ocular viscoelastic devices, etc. So these are certain specific detailed information has been given that the surgical instruments and required linen must be autoclaved using long sterilization cycle. The nurses and doctors, they must ensure functioning of sterilizations. They said for high volume surgery, minimum 4 5 sets or trays per OT should be autoclaved and should be available. And different things have been added. I think there's no need to go into detail of each and everything. In fact, for instruments, they said chemical sterilization should be strictly avoided, the glucuronide and acetones. You should use high speed sterilization or flash autoclave for sterilization of surgical instruments in between the cases. And for phacoemulsification, the phaco needles for every 5 Ks, and sleeves and irrigation aspirations handpiece for every case should be sterilized. Documentation, Dr. Harpreet has mentioned, in fact, they have given guidelines related to documentation of sterilization process. For intraocular irrigation solution, probably they are one of the important cause of endophthalmitis. They said both ringer lactase or BSS can be used, but package should be either flexible bags or in bottles. And they should be rechecked. If there are any visible suspended particles or any leaks, they should be discarded. Any leftover solution should be discarded at the end of the day after the surgeries and should not be stored for use or reuse on next day. For surgical supplies, they said should avoid OVD in plastic disposable syringes. Either use glass syringes or glass vials. And for any intraocular injections, including trypan blue, diaprac in the glass vial can be used multiple times, but on the same day. But any leftover solution should be discarded after the surgeries and should never be stored for reuse. They have given some specific guidelines about patient preparations on the day of surgery, scrubbing and gowning, cleaning and wrapping, and also during the surgeries. The topical antibiotic should be used before and after surgery. And you know, just pre-operatively, the preocular skin should be cleaned with povidone iodine's 10% solution. People are used to dilute it. It is recommended 10% iodine solution should be used. Scrubbing and gowning, the surgeon should perform 3 scrubs with the solution equivalent to 4% chlorhexidine gluconate for at least 3 to 5 minutes under tested running water. And as Dr. Harpreet mentioned, the cloak should be available in that area so that they can actually see the time, and should be in methodical manner for distal to proximal areas. Guidelines for clean and draping of patients are specified. Then even during surgeries, about use of some subconjunctival injections, gloves change, separate